time. Please note that we will put the flyer in the registration in the chat box for you to sign up for that. So thank you for taking time today and spending it with us. We value your participation. Now it is my pleasure to introduce Kathy Salazar. Kathy Salazar is a lead liaison with Parents Reaching Out. She has 9 children, 3 bio children and 6 adopted children who vary in medical complexities. And she is an expert, I feel like, in navigating different systems and really advocating for her children in the healthcare and education system. And so we are happy to have her here today presenting the telehealth and Can I See My Provider? Take it away, Kathy.
Thank you, Wendy. Good morning, everybody. I'm so glad that you're all here with us this morning. I just want to welcome you to this new Parents Reaching Out workshop, the nuts and bolts of telemedicine. And today we'll be discussing, can you see your provider? And really looking at the essentials for a family-centered telemedicine experience. First, we'd like to acknowledge our funders. This workshop was provided for us through the Health Resources and Services Administration, or HRSA. And if you want more information on who HRSA is, please go to hrsa.gov. So we always like to start our webinars with a quote from the Greek physician around 400 BC. Wherever the art of medicine is loved, there is always the love of humanity. And this is by Hippocrates. So today we're going to be talking about what? What is this? What are we doing? Hardware and software. How do I see my provider? What is a portal and a platform? The 4 keys to see your provider, which is email, text, login, or to call your provider. And then we'll also discuss platforms and portals, and we'll talk about 5 specific types. We'll also talk a little bit about HIPAA and how this is impacted by telehealth. And then we'll talk about testing out your platform or your portal. So we have a couple of learning objectives for today's webinar. So the first thing is we're hoping that by the end of today, you're going to learn to determine if you have access to a TeleReady platform or an app needed to see your provider for a visit. Well, number 2, we're going to ask if you do not have access to a TeleReady platform, then can you identify 2 other options for accessing the TeleReady platform for your provider? And number 3, if you do have access to TeleReady platform, can you demonstrate 1 way to test that platform prior to your telemedicine visit? So DigiWhat? Let's talk first about telemedicine and telehealth. So telemedicine is often used interchangeably with telehealth, but is technically focused on the clinical aspect of care, such as a video appointment with your child's pediatrician. So for example, a telemedicine or virtual therapy session with your young child's adult could be with their therapist. And now what is telehealth? Telehealth is used as an electronic information and telecommunication technology to support long distance clinical health care. It is a patient and professional health related education you can do on this. You can do public health and health administration. And the last one we want to talk about is we want to talk about the digital and connected healthcare. Along with that is also the technologies that are used in telehealth, like video conferencing, the internet, storing and forwarding images like x-rays, streaming media. Let's say your doctor wants you to see a video, terrestrial and wireless communications. Oh my gosh, what crazy words. Terrestrial just means satellite that's in space. So next, digital and connected health. Digital can mean mobile or wearable. We all see those new advertisements for glucose monitoring for people who have diabetes. It goes on their arm and they just hold their phone up to it and they've got a wearable technology. It's really important to know that this technology has really become helpful in monitoring health status or behavioral status almost on an as needed basis for your physician. So we want to share with you two terms to know. Hardware, it's the type of electronic equipment. So if you're seeing this webinar on a computer, a laptop, your smartphone, that's hardware. That's the encasing of the electronics. But what we really want to talk about is the software. And sometimes the software is like the applications, the programs, the operating instructions for a computer. So let's think about some of the things that are software. Software such as any games that you play on your tablet or your phone or your laptop, shopping apps like Target or Sam's Club or Costco. Those are what software is. So in today's webinar, we're going to discuss software specifically to portals and platforms. And to see your provider for a telemedicine appointment, you will need software. The software is often called a platform, which may be accessed through a portal. So you can see your provider and so your provider can see you. So let's discuss exactly what the difference is. So what is the difference? A platform, for example, you're using Zoom today. That is a portal. But what is a platform? A platform is a secure telehealth software system which allows a provider and a patient to have a secure two-way video interaction for a virtual visit. The next one, which we always hear, is the portal. The portal is the website or the web page that provides access and links to other sites. It can be in a healthcare setting. It may include access to electronic medical records, messaging your doctor, online appointment scheduling, those type of things. One of the ones that we know of here in Albuquerque is Epics, and MyChart. Presbyterian uses that system as a portal. So what are ways that you can see your provider? So sometimes portal, platform, website, app, software, they're all used interchangeably. And that's to mean that you as a patient can see your provider for telemedicine appointment. There are literally over 150 possible ways or platforms out there to see your provider. And we're just going to pick a few to talk about today and to describe to you what they do and how they do their work of enhancing a telehealth or telemedicine appointment. So just the few that we're going to talk about, we're going to talk about Skype. We're going to talk about Armwell. We're going to talk about VC. We're going to talk about DoxyMe. We're going to talk about Teams, Microsoft Teams, MyChart, eVisit, Zoom, and a portal from your local hospital, such as UNM uses Cerner. So who picks these platforms? That's really important to know because we as patients don't have any way to pick a platform. The providers pick the platforms and they will decide how we see them and what they will use for their practice. And even in some practices, if they're outside of a hospital setting, each provider may use a different type of platform or portal to use to contact their patients for telemedicine. But what you need to do is, if this is going to be the way that you're going to have a medical appointment for you or your child, that you really contact your provider to make sure that you know what it is if they have not already sent you the information. So just as you have to enter an exam room to see a doctor in person, we also have to open an electronic door to see our providers for telemedicine. So you will also have to open what we call a virtual exam room, which is the same as a door, to see your doctor. But in this case, you have to have a key. So there are 4 keys to open this virtual door. So let's talk a little bit about what those 4 keys are. Wendy, do we have any questions in the chat? Okay. So the 4 keys to a virtual door to see your provider are email, text, a login, or a call to your provider. And while you may not need a real metal key to open an exam room door for a telemedicine, you're still going to need some kind of key in order to protect your identity and for the security and confidentiality. You will need a virtual key to access your telehealth visit. So let's dig a little deeper into understanding what those keys do. So let's talk about email. The first key to see your provider is by receiving an email with instructions and possibly a link to join a video call. And the links are always going to show up in blue, whether they show up on your cell phone or they show up on your computer or your tablet. They will show up as blue numbers or letters. So in order to receive these instructions, though, you will have to have an email address. And because you are all here today on this Zoom workshop, you all have email addresses already, but this is something that's really important for your doctors to make sure they get the right information to the right individual. So email words to know. Email, of course, it means from one computer to another and requires an address. Login, it's a username and password that's used to get into a private website. Username, an identification used by the person to access that computer or online service. And then password, which is a username that's unique to that private website. So like today, we sent you, in order to register for this workshop, you had to register through a Zoom link. And then after you registered, and we sent you a unique ID to get into this workshop. The second key is is text messaging. And so your provider's office may send you a text message with instructions. So let's look a little bit more about what that looks like. So a text message, as we all know, is a short message sent electronically from usually one cell phone to another, might be from a tablet to a cell phone. The link will be a hyperlink. Again, that's the information that usually comes up in blue in the message. And it's a reference data so that you can follow by clicking or tapping that specific link in blue. And then SMS. SMS stands for short message service, and that refers to text messages. Well, oops, sorry, went a little bit too fast. Well, MMS, which is multimedia service, refers to messages with pictures or videos. All right, and the third key is about logging in. How do you log in? So your provider's office will maintain and give you access to, or the health system that your provider is part of will give you access to. Many portals require you to have a username. Just sometimes they use your email address and a password that's unique to that website. So again, it's how you got into this workshop. That's the closest way I can describe how you are able to use a login. So let's talk a little bit about portals and platforms. A portal is a website or web page providing access or links to other sites. In healthcare settings, it can include electronic medical records, messaging your doctor, getting an online appointment, scheduling, or access to the health appointments, telehealth appointments. So for example, if you have access to, let's say, Presbyterian here in New Mexico, you can use My Chart to do this. But a platform's just a little bit different. A secure telehealth software system, which allows a provider and a patient to have a secure two-way, high-resolution video for a remote visit. That's literally where you see each other over a screen. Some platforms will also allow a provider to share medical images such as x-rays or the possibility of seeing what your lab work was. And they'll allow the provider to also send text messages or online charts in real time, or they'll allows them to send prescriptions. I don't know about you, but it's been a really long time since I took in a paper prescription into a pharmacy. Most of them now are electronically transferred. So just realizing that Zoom is software that allows you to have this video interaction with us on this workshop. So what are login words to know? So login words to know are username, login, and password. And so as far as website and web page, a web page is specific to a collection of information. So let's say you type in parents reaching out on a browser, which is a unique way of surfing the web. That browser, you'll type in parents reaching out and it'll take you to our website or our web page. And it'll display to you lots of different information. And from there, there's usually drop down from each different part of the website so that you can pick the different information that you would like to see. Software, on the other hand, can be programs. It can be applications or apps or operating instructions for the computer, for the hardware to work. And apps is just short for application, which is the same thing as a software program. It's just most specifically used on mobile devices, such as our smartphones or our tablets. The last of our 4 keys is to call your provider. And in doing this, and if you have difficulties with any of the ways of getting into your telehealth, telemedicine visit, you're going to want to make sure you know how to get a hold of your provider, their office phone number. There may also be, if there's big, if it's coming from a big hospital system, there may also be a telehealth department or technical support that you can call if you're having problems getting in or not understanding how it works. Just know that if you do call your doctor's office and you speak to whoever answers the phone, such as a nurse and a medical assistant, they might not have the answers to certain specific technical questions. The reasons that you would want to call your provider is because you can't access the portal, you do not have the link, or you're having difficulties getting in or navigating the portal or platform. Let's just stop for a second. And number 1, I want to ask if there's any questions. Thank you, Wendy. What does HIPAA stand for? Because HIPAA plays a big part in how this whole telemedicine visits were developed, that had to be very specific for telemedicine in some of its rules and regulations. And we'll talk a little bit about how the public health emergency has affected HIPAA. So HIPAA stands for Health Insurance Portability and Accountability Act. The Health Insurance Portability and Accountability Act, usually called HIPAA, it's a law about information. HIPAA creates rules about the ways that private health information, sometimes called PHI, private health information, can be shared or stored or used by anyone other than the person it is about. So let's say, for me, instance, I have access to my daughter's medical records at CHOP, which is Children's Hospital of Philadelphia. And so HIPAA protects that by having a specific login and rules and regulations about what HIPAA looks like for that login for me. Most of your health information is protected under HIPAA, including all personal information that could be used to identify you. like your previous health history or health status or payment information. Sometimes we have credit cards or insurance cards posted on those on part of our identification through through our system that we use to access our medical records. However, HIPAA doesn't protect health information that doesn't explicitly link to you. So it might be general information about the hospital or general information about a condition, but that's not anything that's specifically linked to you and can be more or less anonymously added to a medical database. So let's talk about what's happening right now during the public health emergency. And we did get notice yesterday that, or this past week, that the public health emergency from the federal government has been extended through July 19th at this point. So they extend it out usually every 90 days during the emergency. So during a public health emergency, providers can use non-HIPAA compliant platforms as long as it is done so in good faith. Oh my goodness, what a thought, good faith. And the platform is non-public facing, and we'll talk about what that means in just a second. So they can use anything like FaceTime, Facebook Messenger, Skype, the traditional form of Skype, but they can't use products like Twitch or Facebook Live or TikTok or YouTube. Those are public facing applications. So what is HIPAA versus non-HIPAA platforms for telemedicine? Well, first of all, logging in to your appointment through your password protected MyChart, let's say Children's Hospital portal versus TikTok. Which do you think is protected? Well, MyChart would be protected and TikTok would not. What about if you had Zoom versus FaceTime on your Apple phone? Well, Zoom is going to have a protected version of it and FaceTime will not. But that's part of the public health emergency is right now, something like FaceTime can be used as a HIPAA compliant as long as it's done in good faith. TikTok, on the other hand, cannot be used because it's public facing. So let's talk about the five platforms that we've chosen to just talk about during this workshop. The first one we're going to talk about is DoxyMe. DoxyMe, Zoom for Healthcare, Microsoft Teams, a provider-specific portal, or an on-demand visit provider. These are only 5 examples of hundreds of platforms that can be available for telehealth. Family Voices presents these here for informational purposes only. There's no endorsement applied to any of these platforms. So you may have to use different methods to see various providers for your online telemedicine appointment. For instance, your child's pediatrician may use Zoom and their cardiologist may use a hospital portal. So most platforms will include video chats, video calls, shared screens, a shared screen might be like what you're seeing right now is I'm sharing my screen with you so you can see this presentation. And also we're looking at HIPAA compliance. That is what a platform would require. So in DoxyMe, DoxyMe actually supports 9 languages, including Spanish and English. There's no need to download software or create an account. It is HIPAA compliant, and families can use this to ensure that they're logged into they have to use this, in order to use this, they have to make sure they're logged into their email account along with their username and their password. Zoom for Healthcare is different than the Zoom that we're using today. Zoom.us/healthcare is a HIPAA compliant website. It supports 11 languages, including Spanish and English. It is HIPAA compliant, and there's 2 types of Zoom accounts. Again, the zoom.us, which is what we're using today, and then the Zoom health.us/healthcare, which is HIPAA compliant. Microsoft Teams, that was recently just upgraded to become HIPAA compliant. So if you have an office, the 365 Office suite with Microsoft, Microsoft Teams is part of that suite. It supports 36 languages, including English and Spanish. It is a HIPAA compliant platform, and it replaces Skype Business/Healthcare, which is being discontinued as of July 2021. Any questions yet? Okay, great. So what is a provider or health system specific portal?
Kathy,
There are,
I just wanted to say that that's really great information to know going forward for individuals. So I just wanted to say that's awesome. Thank you for sharing that.
of course. Thanks, Wendy. So a provider or health system specific portal, there's hundreds, if not thousands, of different healthcare branded patient portals. HIPAA, most are HIPAA compliant, but always best to ask your provider about their specific portal. A few portals include MyChart, which is usually supported by Epic, which is a medical record company. They do hospitals all over the world. They translate their medical records into a HIPAA compliant portal that it maintains all of those records. But then there's hospital specific portals, like specifically to UNM, which is using Cerner at this point. So here's an example of what a children's hospital portal, in this case, the Children's Hospital of Pittsburgh, might look like. And so as you can tell, you would need to put in your login information on this website. And a lot of these websites have also have apps, which we would use on our smartphones or our tablets, so that they can usually be accessed both through a laptop, a desktop computer, or a smartphone or a tablet. Other tasks that you can do in a portal, which are different, is you can schedule an appointment. You can give family access to their child's medical records, like what I was talking about a minute ago. I have access to my daughter's records out of Philadelphia. You can message your provider. You can pay your bill. You can view a list of medications. You can view health profiles. You can get directions to any of their clinics. And you can also find a doctor within their system. So this is a really convenient way to manage healthcare information, is through a portal. And it's not just done with children's hospitals, it's done with hospitals all over the world. So let's talk about on-demand visits. And these are the type of visits that you would go to your insurance company page and say, I need a televisit because for urgent care. So these are called on-demand visits. For an on-demand visit, you will not be seeing a provider you have met before. So some of the apps that can be used for this include Doctor on Demand, Amwell, MeMed, Teladoc, and MD Live. And payment is out of pocket primarily, unless you go in through your insurance. But these are usually cash-based, credit card-based visits, and they're quick. They see you for very specific reasons, and they're very limited in the scope of treatment of what they do. So you have an earache or a sore throat, maybe something that is not involving with a fever. They may want to go ahead and see you, but this is completely up to whatever their requirements are on what would be specific to their group, on what they can see and how they can treat someone over telemedicine. So just a quick review. There are 4 keys to see your doctor for your telemedicine appointment. You're going to want to have an email. You're going to want to have text messaging. You're going to want to have a login, and you're going to want to be able to call your provider if there are issues. But you might be wondering, what if I don't have one of the keys and I still want to see my doctor? And how do those keys, what happens if one of those keys is not working? What do we do next? So here's some alternatives to seeing your provider or accessing their platform. You can call your provider. You can seek, you can call someone in the practice and they called, or the practice called you and they walked you through what to expect, wanting to do an appointment via telemedicine, but that is not available. And you referred to urgent care or ER. Or resorted to an insurance telemedicine, which is those sites that we were just talking about, Teledoc and those other ones. You can also do a patient going to a clinic and a doctor is on video. So maybe the doctor's not there in the office, but they're on video with you. And the provider just may be in another location, but you're using that office's hardware, which is the computer or laptop, to be able to access that doctor. Some of the things that you may want to do is really like policy stuff. Are there lots in place right now for COVID that may or may not remain in place? Absolutely. And things may be changing when the public health order is finally discontinued. Calling a nurse advice line, that's always really helpful if you are just wanting to ask some questions. New Mexico has a nurse advice line. When a person can't do links or technology, they may reach out to their provider by phone, asking about what in-person options may be available or what their comfort level is during COVID, or looking online tutorials. You can learn anything on YouTube. We can learn just about anything: how to fix a car, how to reboot our child's Apple Watch, which I had to do recently. And so, yeah, we can find out from YouTube. We can go to a neighborhood, reach out to a community, advocate for a multi-generational inclusion center. Ask your teenager. They usually know more about this electronic stuff than sometimes we may. Or literally, like the game show, phone a friend. Find out if someone else knows how to do this. So there's lots of different ways to figure out how to do this. Just a reminder that pressing 0 on your telephone is not always the best option. It's always a really good thing to listen to all the prompts when you call your doctor or your hospital, because things do change. And so you want to make sure that you're getting your information to the person that needs to get it for as quickly as you need it to be gotten. So let's talk a little bit about testing your platform. So at least 2 days before your appointment, you're going to want to log in to your provider's portal or follow the link in the email or text message that was sent to you by your provider to access that appointment. If you haven't received any instructions from your provider, you're going to want to make sure that you call them, because you don't want to be doing this that day. It's going to be really, really difficult if you're getting on 5 minutes before your appointment time. So again, website versus a text message that may have a link in it that will take you to where you need to be on whatever platform they may be using to log into your appointment. So if you cannot access the platform or portal or do not have an email or text link, you have to call your provider's office and make sure that they know what's going on. So let's say your phone got lost, something happened, you don't have it with you, those type of things, but you need to make sure you still have your appointment. What does that look like? Don't wait until the day of your appointment or minutes before your appointment, because it really becomes too late and you may have to wait some time to get another appointment. And find out who does the technical expertise within that doctor's office or within that hospital system, that if you do have schedules, who do you talk to? Not schedules, I'm so sorry, questions. So before we finish today, we would really appreciate your evaluation. This workshop is brought to you by HRSA through Family Voices. Parents Reaching Out is the Family Voices affiliate for New Mexico. And this presentation was all about, can you see your doctor? And so you can either copy the link to a web page to do this evaluation, or you can hold up your phone to the QR code, which is that fuzzy little square, and it'll take you to the link on your cell phone. If you have any questions about how to do this, you can certainly ask that right now. We'll also be sending out this information along with these slides to you later today or tomorrow with more information regarding telehealth. Can you see your provider? I would like to thank Wendy Ford-Lycon. She put together an amazing amount of resources regarding telemedicine and telehealth. These are all live links. So when you get this when you get this PowerPoint, you will be able to go to these different websites to find out information about New Mexico and telemedicine, and Yes, New Mexico, how to apply for Medicaid, and all kinds of other things. So she's got 2 pages here of great, great information. And thank you, Wendy, for doing that. It's so appreciated. So who nowadays would ever use a bank that makes you come into a branch to access your money? 5 years from now, the question will be, who is going to go to a doctor's office that makes you come in every time you have the sniffles? And this is by Jonathan Linkus. And he talks, and he's with the American Telemedicine Association. And we're just wanting to end this workshop with a quote that's valuable for us to understand that telemedicine is now going to be part of the toolbox of ways to see our doctors, to interact with our doctors, to interact with our hospitals. And I think it's a great change that's going to be happening and going forward. As we have learned through this public health emergency, how valuable telehealth has been. Now, please remember, there are lots of things that you still need to be seen for in person with your doctors. So please don't make this the only way that you see your physicians, your therapists. Make sure it's the right way for the right thing. And we want to thank all of you so much for attending this workshop. And I'll go ahead and stop sharing my screen. And if we have any questions, we would be happy to answer them at this time.
Thank you, Kathy. This information is so valuable because now with this technology that is changing all the time and the trend to telehealth, so it is completely like pretty much new that we're using, but very valuable. So thank you for that.
Thank you, Paula. And I will be sending out this recording, and it does have Spanish subtitles. So for your families, if they want to watch this.
Yes, that would be wonderful. Thank you.
You're welcome.
Thank you, Kathy. That was really great. Informative. I didn't realize some of those, different platforms and, what is approved and what isn't approved. So that's always really good to know in the event that, you're in a pinch and you need to see your provider. So that's really great. So thank you. You did a great job.
Thanks so much. All right. Well, thank you all so much for attending the workshop today. We appreciate your time, and thank you so much. We'll be getting this information out to you in the next day.